Mild spacing, very simple too as well. 10 aligners, close the space. The space is closed quickly. And in this video, we see the treatment plan of mild anterior spacing. This patient had ortho years ago, neglected to wear the retainers, and over time, the bite has shifted in there. So we're going to focus on correcting this case as well. So we go through the same protocols as we've done before. We start with the anterior view or the front view. And then as we go through here, we notice this is done in about 3 trays. Typically, I'll extend this out a little bit more. Because of the anterior spacing, what I found is I'll tend to overcorrect a little bit. And the way that I mean that, if you notice back here in the beginning, it has the green spaces here, or the green dots. And with our collision check, remember the red is colliding and the green means open. There's about 0.2 millimeters of open space between these incisors. Typically what I do, I look at this and say, what can I do to make this a little bit tighter for the patient? So a couple things I look at is, one, because of the open spacing, I'll add additional IPR actually in this case. So there are some cases where I'll just go across and say, you know what? I want this really, really tight. We'll do fake IPR. And typically what I'll do, I'll go back in the treatment plan and add an additional 0.2 millimeters in these spaces. So with our focus being the maxillary anterior, we are going to focus on that and get a closer look. So as we go through the sequence, like we said before, we have our collision check and our bite check in place there. This case has no attachments, and I'm not so much concerned about attachments for this case because we're closing space. If we're doing a little bit more rotation or need more anchorage, sometimes I'll add it, but we're really focusing on the patient's chief complaint, which is basically the maxillary anterior. Like we discussed before, for the front view, typically I really do look at that smile line. I try not to alter it too much and sometimes improve it for most patients, but with this case, with just a few trays in there and closing space, I think we look pretty awesome. All right, so let's go through this case. As we go through with the collision check and the bite check on here, these are some of the things that I think are crucial. Probably for the bite check, this is a little bit of a concern. If you notice, even in the beginning and then all the way to the end with 3 trays, areas in red show heavy, heavy occlusal interference. So typically what I do is what we discussed before, we kind of look at the back view and kind of get an idea what's going on back here. And yep, just like we thought, a lot of pressure from the mandibular incisors. What's happening is reducing, it's making the anterior teeth space out just a little bit. Let me fix this here. Sorry about that. So let's get back to our view this way. Yep. Okay. So here are some of the things that I typically do. We're forecasting a lot of extra space in there. Fake IPR to help reduce it. We're also noticing an heavy incisor occlusion in here. As the patient bites, there's a lot of weight load on these anteriors. So this patient's going to probably need not only fake IPR, but we're also going to need a little bit more of an incisal adjustment across this area. So for this case, typically, I may stretch this out a couple more trays just to close the space a little bit tighter. Probably for this case, I might add a couple more trays. I'm thinking maybe 6 trays, and maybe double this up, maybe 8 at the most. What I'd probably do for this case is about halfway through, if there's about 6 trays, maybe 8 trays in there, incisal adjustment. So typically what I would do is have the patient back, probably for the first visit, for the first tray, I probably start with a little bit of incisal adjustment in there. Other options you can do is for the bottom, as we see the occlusion in there, we see how heavy it is here too as well. This is going to probably need some occlusal adjustment as well. Other options too, because we're focused on the maxillary anterior, this case, because of these premature interferences to move, typically we may have to add some mandibular movement as well. So I may actually open this case up to maxillary mandibular movement. I may add a little bit of IPR on the bottom to give a little bit of relief for the maxillary anteriors up top, and then probably rerun this case through. So for this treatment plan, we're going to add mandibular movement. We're going to do a little IPR on the mandibular incisors. What I'm going to do is a little bit more occlusal adjustment, maxillary mandibular, help this case along. And then what we're also going to do is add additional IPR and some more trays to do fake IPR to close the space a little bit tighter. But this case turned out amazing.